lot of people do not know that there is a big difference between plastic surgery and cosmetic surgery, because anybody could call themselves a cosmetic surgeon, but to become a plastic surgeon, you literally have to be 6 years in training. Well, plastic surgery is the surgery, the shape-giving surgery.
Sometimes they talk about dolly body, they go to the plastic surgeon to get a dolly body. You ever heard of that term?
Yeah, I've heard of that term. That is a dolly body to use, not a dolly body to me. So I guess what they want is they just want to look sexually appealing, you know.
Brazilian butt lift.
Brazilian butt lift. Yes.
What exactly is that?
Okay, so I can tell you what it is not. It is not Brazilian and is not really a lift.
In Office with Dr. Jevon Samuels.
Welcome to another episode of In Office. I am Dr. Jevon Samuels. In office with me today is Dr. Jan. He's a plastic surgeon, and I'll allow him to give us more introduction where the plastic surgery is concerned. So welcome to In Office, Dr. Jan.
Welcome.
All right. So can you just tell us your credentials and qualifications and how long you have been practicing?
Okay. So I'm a double board certified plastic surgeon, hand surgeon, and general surgeon. So in terms of my clinical upbringing, I studied in Germany. I did basically all my electives, all my practical parts as a student here in Jamaica. That is my connection to Jamaica. But I finished my studies in Berlin. And afterwards, I started rotation in general surgery, which I became a general surgeon in 2004.
Okay.
So now in 2004, I was considering to stay in surgery, maybe go into trauma, or I couldn't really decide, because the things that I loved most about surgery was really part of plastic surgery, namely hand surgery and the reconstructive detailed surgery like microsurgery and those things. So I basically immediately after becoming a general surgeon, I went into a second rotation to become a plastic surgeon.
All right. So what exactly is plastic surgery?
Well, plastic surgery is the surgery, the shape-giving surgery. Basically, in the European tradition of plastic surgery, you can say that there are 4 columns that would be reconstructive surgery, for example, after disease, tumor, congenital issues, to basically reconstruct a situation that is closer in form and function to the natural healthy part. Second would be burn surgery. Burn surgery, you can call it as part of reconstructive surgery, but is also the primary care of burns, which in European tradition was in the hand of plastic surgery. Okay. This is changing a little bit now. The third part of it is hand surgery, and there especially the microsurgery of blood vessels that are small, like 1 millimeter small nerves, but everything else, bones, tendons, ligaments, everything that can happen from the elbow to the fingertips is part of hand surgery. And last but not least, and this is what people basically know most about plastic surgery, is the aesthetic or cosmetic surgery.
Okay.
Yeah, which is in plastic surgery as part of the training. So now that is something what most people understand to be plastic surgery, and a lot of people do not know that there is a big difference between plastic surgery and cosmetic surgery, because anybody could call themselves a cosmetic surgeon, but to become a plastic surgeon, you literally have to be 6 years in training.
Okay. All right. So today we want to focus on the general introduction on cosmetic surgery. All right.
Okay.
So what are the common cosmetic surgeries that is performed here in Jamaica or by yourself?
These things are primarily anything related to breast and trunk. So very popular is liposuction. The fat transfer, or commonly known as BBL, is something that is very popular here, but also all kinds of breast surgery, breast lift, breast augmentation. Breast reduction is super popular, but that is not cosmetic surgery. That is more in the direction of reconstructive surgery, and is also covered by insurance. Now, but we do also see facial cosmetic surgery, facelifts, rhinoplasties, lip lifts, blepharoplasties, all these things.
Okay. All right. So we can start looking at breast augmentation. What are some of the issues or complications that persons can have from breast augmentation?
Well, breast augmentation, complications that are specific to breast implant augmentation would be things like infection, of course. Now, infection, if you have an implant, would always lead to a removal of the implant. But you can also have more long-term issues, as for example, capsular fibrosis, where after some time, maybe a year, all of a sudden the breast starts to feel hard or can be distorted, painful, and then you would also have to remove at least the capsule to establish that original result again.
All right. So what are some of the main reasons for why patients do breast augmentation? Because it's just for beautification purpose, or it's anything health related?
No, it's not health related.
Mainly the
So if you're looking maybe at mental health issues, you can say, all right, it makes a big difference for their feeling about themselves. Now, if you want to put that into mental health, then okay, that would be the only issue. Otherwise, cosmetic surgery is literally not related to health, and that's why insurances also won't pay for it.
Okay, all right. So as I said before, this is just an introduction to different cosmetic surgeries and plastic surgeries overall. And so you also mentioned breast reduction surgery, but the insurance would cover breast reduction surgery. Why is this so?
Well, okay, so as a condition, we call it the symptomatic macromastia. You have very clear, defined symptoms that are related to the big breast. And I must say, it always astonishes me how many colleagues are not aware of these symptoms. So very clearly pain symptoms in shoulder, neck, back, in the chest. Chronic migraines are very often related to large breasts. And of course, the skin issues like intertrigo under the breast, the discoloration of the skin. Now, these are all hallmarks of the symptom complex of the big breast. And I can tell you that the grand majority of the patients that undergo breast reduction, they have an immediate improvement of those symptoms. Very often they're not even aware that the symptoms are connected to the breast. So for example, now everybody knows the shoulder pain because the breasts are hanging on the shoulders. They can really, but that, for example, the migraines they've been suffering from for years are related to the large breast. A lot of people are not aware of that.
Okay.
Yeah, but the effect, as I said, is very often instantaneous. Yeah.
Okay. So in terms of the costs, with and without insurance, what's the average cost we're looking at breast reduction surgery?
It depends a little bit on the size. So if you look at a regular breast reduction, now are you talking about what the cost?
Average cost in Jamaica, yeah. Average cost in Jamaica.
Now you can calculate about 6,000 US, or the equivalent of that in Jamaican. So it's about 900 something
Per breast or both?
No, you do both. That's for both breasts, and that's for surgeon fee, anesthesia, theater fee, the post-op. So basically everything except the post-op medication and the bra, stuff like that. But that's a small amount that would have to be added towards that.
Okay, all right. Now we can move on to liposuction. So that's also a common procedure. So what are the different types of liposuction that they have? And
okay, so in terms of the technical difference between the different methods of liposuction. So now, as a overall method, you can say it is that we use cannulas that have small openings at the end with sharp edges, and we apply negative pressure, meaning suction, through that cannula, and we infiltrate the area that is being treated with so-called tumescent solution. That is that's a saline solution that has medication in it that will cause numbing and will also cause a reduction of blood flow there with adrenaline, for example. And then we will we'll create a small hole, and we will insert the cannula and move back and forth, and through that negative pressure, fat will protrude inside the cannula and then being sheared off. And by that we can remove about, you can say maximally about 4 liters of fat. That is a big amount. Now in Jamaica it is not regulated by legislation, and in the United States, from what I know, I think 4 liters of fat is the maximum that you are allowed to remove, which makes sense. It is a lot, but I would not recommend to do more than that, because basically for every liter of fat that you remove, you have to instill tumescent solution in the tissue that has to be dealt with by the body. So everything goes through the vascular system, through the liver, through the heart, through the kidneys. So that is a stress for the body.
Okay. So in terms of the areas of the body where you normally perform liposuction the most, it's like in the abdominal.
Yeah, most of the times is abdomen, sides, back. Then I would say arms, sometimes insides, thigh, chin, but those are the most common regions.
So insurance cover these liposuction?
Not. So now you have to also look at Jamaica. Jamaica, definitely not.
Okay.
Now I know in Germany and the Netherlands, for example, if the liposuction is part of something else, for example, you need fat to reconstruct a scar or to correct a scar, or to treat something where you need fat, then that would be covered. But that's not liposuction as a means of slimming somebody down, but liposuction as a means of harvesting fat. So no, it's not covered.
All right. I think on the side you have something about some mommy makeover. Yeah, I was curious about that. What exactly is a part of the?
So now you see that what we're dealing with in that part of the industry is we're using a lot of those marketing terms that are known by people that are interested in, so they will go into Google and that will so now the mommy makeover, it basically is addressing issues that women have after giving birth, which is a combination of tummy issues and breast issues. Now, there is not a clear-cut definition of what the mommy makeover is. Most of the time, it's a combination of tummy tuck and breast lift, but it could also be just liposuction and maybe breast reduction or a breast augmentation. It is really the combination of the treatment of complications of pregnancy.
Okay. So, no, I see sometimes some celebrities, they also have like the face and nose surgery. Those are performed in Jamaica as well?
Yeah, we do that as well, of course. Yeah. So Now you can say, and in a primarily black demographic, you have there are different requests. Let's put it that way. So now white people do age earlier in life, and they because of the quality of the aging of the skin, very often come to the plastic surgeon in their 30s and 40s with requesting blepharoplasty, lip lift, facelift. So now here in Jamaica the demographic is a little older. So normally before 50, 55, a Jamaican woman does not need a facelift.
Okay.
Normally.
No.
Now, of course, that is, we have ethical differences here as well, but so you can say that the demand is lower than but we do that. So
Okay.
deep plate facelifts and all these things are done here as well.
Okay, good. Sometimes they talk about dolly body, they go to the plastic surgeon to get a dolly body. You have heard of that term?
Yeah, I've heard of that term, and I must say I find it a little the dolly body. I'm sorry, it's not. It's like, what is that even? It's, so no, I guess this is one of those marketing terms. Yeah. So now, what is a dolly body to you is not a dolly body to me. So I guess what they want is they just want to look sexually appealing.
All right. So let's talk about the bottom now. So they say I have this term that they use, Brazilian butt lift.
Brazilian butt lift.
Butt
Yes.
lift. What exactly is that?
Okay, so I can tell you what it is not. It is not Brazilian and is not really a lift. Okay, so what it actually is, it is a gluteal augmentation with autologous fat, meaning augmentation, adding volume to the area of the butt, the gluteal area, and hips for that matter. And what we're using is autologous fat, meaning fat coming from your own body or from the body of the patient that is being treated.
Okay.
So now it's always a combination of a liposuction. Now you need to, when you take out the fat, you need to refine the fat in a way where you don't break the sterile or the chain of sterility.
Yeah.
And you break it down. You refine it to a point where you can re-inject it. Okay, and then you use the proper instrumentation to re-inject it into the area where you need volume.
Okay, all right. Well, in terms of the complications from different cosmetic surgery, is it that the complications are higher than regular surgery that is performed like abdominal surgery, or the complication is less?
No, so you can say that surgeries that are elective or even highly elective, they have to be safer than surgeries that are medically indicated. Now, if you have an appendicitis, and of course you will be more willing to accept complications because if you don't treat it, you might die from it. Okay.
Yes.
So now, when we look at aesthetic surgery being highly elective, that means that you have no medical problem. Then you have to try and reduce all the possible complications or reduce it to a point where it's acceptable. Okay. So now, in terms of numbers, the complication rate is by far lower, but that is also not only because it is to be expected, but we also can control the patients that we use.
Okay.
Okay. So now, if you have somebody who needs a cholecystectomy, then you can't say, okay, well, you are overweight. Now we can't do the surgery on you because they will need the cholecystectomy. And if they're diabetic on top of it, then you have two reasons why there is possible complications. Now, if I do a liposuction, I do not do liposuction on people with a BMI higher than 33, because we know that if you have a high BMI, any type of complication, whether it's the small local one or the very dangerous ones, are more common and more severe in somebody who is overweight. Okay, so now, and you were talking about the complication rate in the context of the BBL, and so I see where you're getting it, because the BBL had a little bit of a bad reputation. You can say that the BBL, or the fat transfer, got more and more popular as of 2008, 9, 10. That's where it started, and it was a rapid increase. I saw it in my community, where people all of a sudden started doing that, and it was 2016, 2017 where it was a sad reality that you'd see people dying in that procedure quite commonly, and that would happen especially in areas where they did a lot of those procedures, like Miami, even DR, Colombia, those places where they did a lot of them. Now it was to an extent where in 2017 the ISABS, the International Society of Aesthetic and Plastic Surgeons, formed a task force to see, get to the bottom of it. Why is this the case? And what they saw was that the reason why almost all of those people died was they died of a thing called fat embolism. And that is a complication that prior to that we actually only knew from these big traumas like broken femurs and hips and stuff, where fat was all of a sudden then shifted into the bloodstream and could kill someone. In the case of the BBL, it was always an accidental injection into one of the big blood vessels that are in the gluteus, in the muscle. So now the reason for that was that in the beginning we were very much concerned about the environment where we would put the fat cells into. Because fat cells, they don't come with their own blood vessels, so we have to put them into an environment where they get oxygen and blood flow. And the muscle is actually an environment where the fat cells love to be. So that was always really good. Problem was that there are two major veins and two major arteries in each of the butt cheeks. And so it just happened too often that all of a sudden a vein got injured, and then just by the pressure of the fat in the muscle, and that the veins can literally suck. If you have low central vein pressure, can literally suck in the fat. So that was the reason why it was so dangerous. Now the ISABS has adapted the guidelines and has clear-cut recommendations of what is not to be done. And one of those is not to inject into the muscle under any circumstances, which to my knowledge is broadly accepted. And you can say from 2017 the numbers have dramatically changed to the better.
For now, the introduction, as I said before, I hope to come back and talk about these procedures in more details on an individual basis. Alright, so for now, thank you very much for taking the time out to come on this show. Alright, and a part of this program normally allow the guests to advertise their business if they want to do so. So if you want to talk about Pro Surgery Care here, you can go ahead and just tell them where you're located, with contact information, etc.
Alright, so we are located, Pro Surgery Care Services, we're located at the Waterloo Fontana Plaza on the second floor, where we have 3 large operating theaters. We have a ward. We have other specialties that come here and work with us, orthopedic surgeons, general surgeons, gynecologists, GPs. So for all your medical needs, not only for the plastic surgical needs, all your medical needs, you can come here. You can get in touch with us under 876-630-4042, and you can just Google us, Pro Surgery Care Services, or Plastic Surgery Jamaica.
Okay, all right. Thank you very much.
Thank you. It was my pleasure.
Good, all right.
Be sure to subscribe for more informative contents on life, sickness, and death.